Bismillahirrahmanirrahim. Welcome to my channel, Doctor's Goal. Today our topic is amyloidosis. So first definition, amyloidosis is a condition in which misfolded or amyloid proteins stick together and form amyloid fibrils, and these fibrils build up in the tissues, lead to organ failure. Now we'll discuss about types of amyloidosis. So the first one is AL amyloidosis, immunoglobulin light chain amyloidosis, AA amyloidosis, which is serum amyloid associated amyloidosis, amyloid transthyretin, which is familial or hereditary amyloidosis, dialysis related amyloidosis. The last one is senile systemic amyloidosis. So AL amyloidosis, this is the most common type and also called primary amyloidosis. It is associated with multiple myeloma and Waldenstrom macroglobulinemia. So mechanism in which abnormal antibodies released from cancerous plasma cells, especially light chain, that get deposited in kidney and heart, lead to range of symptoms which we'll discuss later. AA amyloidosis, it's also called secondary amyloidosis. It is associated with chronic inflammatory disease like rheumatoid arthritis, SLE, Crohn's disease, TB, infections, and neoplasms. Mechanism of action of AA amyloidosis, in which inflammatory cytokines released due to any chronic inflammation like rheumatoid arthritis act on liver to produce acute phase reactant protein that build up in different organs like kidney and heart. Hereditary amyloidosis, it is an inherited disorder in which body makes a mutant form of protein called transthyretin, and that mutant misfolded protein gets deposits in organ, lead to organ dysfunction. Remember students, transthyretin protein normally produced from liver in the body, and their function is to transport thyroid hormone and vitamin A, which is retinol, in body. Mechanism of action of hereditary amyloidosis, in which mutant tetramer released from liver and change into dimers, and these dimers convert into folded monomers, and the folded monomers became misfolded monomers. Finally, these misfolded monomers accumulate together and form amyloid fibrils, and these amyloid fibrils get deposited mainly in nerve cell, liver, and kidney. Dialysis-related amyloidosis. This form of amyloidosis is caused by deposits of beta-2 microglobin that build up in the blood and deposits in different tissues. This mostly develops in chronic renal failure in a patient on dialysis greater than 5 years. Remember students, normal value of B2M in blood is 0.8 to 3. In patient on dialysis, B2M value is 30 to 50. Normal BM2 release from B lymphocytes in the blood and from blood filtered to kidney and then pass out of the body in urine. But in patient on dialysis, BM2 release in the blood and from blood goes to kidney but not filtered due to renal injury, failure, or accumulation of BM2 in blood and eventually deposited in different organs like tendons, joints, and bones. Senile systemic amyloidosis, it's age-related. In this type of amyloidosis, deposition of normal transthyretin protein in many tissues occur in old age. Signs and symptoms of amyloidosis. When amyloid fibrils get deposited in kidney, lead to proteinuria, protein in urine, renal failure, proteinuria, misfolded proteins deposits around the capillaries wall and damage them that lead to leakage of protein in urine. As a result, develop nephrotic syndrome. Nephrotic syndrome is a condition that causes the kidneys to leak large amount of protein into the urine, leads to renal failure. Large amount of protein in the urine, these lost protein lead to edema or leg swelling. Anemia is due to decreased erythropoietin. and also bone weakness. In heart, in which deposited amyloid protein in the heart lead to restricted cardiomyopathy that cause stiffness of heart. When our heart becomes stiff, it can't pump blood properly, leading to heart failure. Symptom is shortness of breath, palpitation make you feel like your breathing is hard and fast, fatigue and chest pain. Here you see median nerve and flexure reticulum ligament, which is transverse ligament. Twin amyloid protein deposit in ligaments and tendons compress median nerve, pain and numbness in the thumb, index finger, and middle finger. This condition called carpal tunnel syndrome. In amyloidosis, carpal tunnel syndrome are mostly bilateral. Microglossia, enlarged tongue, mostly in AA amyloidosis. In GIT, effect on GIT, dysphagia, diarrhea alternating severe constipation, hepatomegaly, bloating and poor appetite, gastroparesis. So why hepatomegaly occur? Because it's due to accumulation of amyloid protein in liver lead to hepatomegaly. So when amyloid protein build up in joints, so it causes joint pain, joint swelling, and joint stiffness. Effect on skin, bruising and purpura. So why bruising and purpura occur? Amyloid protein deposits in the blood vessels of the skin can make them more fragile, leading to easy bruising. Diagnosis of amyloidosis. Most accurate test for amyloidosis is tissue biopsy. Tissue biopsy stain with Congo red. You see in a given picture, Congo red staining show apple green birefringence under polarized light. Don't forget, students, Congo red. Tissue biopsy stained with Congo red. Immunohistochemistry used to identify the amyloid protein type. Treatment of amyloidosis. Primary amyloidosis, you will give chemotherapy, autologous stem cell transplant. Secondary amyloidosis. Amyloidosis is treated by addressing the underlying condition. For complete treatment of amyloidosis, please watch my video on multiple myeloma, link of which is given in the description box.